Okay, let's go ahead and get started. Welcome and thank you everyone for joining today's session, Publishing Standard Charges, How Hospitals Can Control the Pricing Message. So let's take a look at our objective over the next hour. As I'm sure all of you know by now, CMS is requiring all hospitals to post their standard charge master in a machine-readable format by January 1st. We want you to walk away today with a tangible strategy that you can take back to your leadership with recommendations. And the key word here is strategy. Some hospitals will simply just post their charge master to check the box and meet the mandate. But as we will discuss today, doing just that potentially presents a huge problem in the eyes of your patients. So let's go ahead and launch our first poll question today. And today's first poll question is, what is your confidence level in meeting the CMS price transparency mandate by January 1st? And the options here are very confident, somewhat confident, or not confident. Again, that question is, what is your confidence level in meeting the CMS price transparency mandate by January 1st? The options being very confident, somewhat confident, or not confident. And we'll give everybody about 30 seconds to respond. All right, thank you everyone for voting, and we will distribute the poll results following today's session. So just some brief introductions before we get started. My name is Brad Josephson, and I'm the Director of Marketing here at PMMC. And then also with me today is Greg Kay, Senior Vice President of Revenue Strategy at PMMC. Greg has been in healthcare for over 30 years and advises many of our clients across the country on price transparency strategies. So with that, Greg is going to kick off today's session with the latest updates from CMS.
Good afternoon, everyone. You're probably aware of the pricing transparency rule that goes into effect on January 1st. And hopefully you know that CMS also released a frequently asked questions FAQ document pertaining to the rules. We're going to be covering these today, along with suggestions on how you should respond and get ahead of pricing transparency. Now, the CMS rule states that all hospitals will be required to publish their standard list of prices online in a machine-readable format, and they must update this list of prices at least annually. This statement is somewhat generic, and it left many unanswered questions, but Secretary Azar's statement was very clear. CMS is looking to move the industry to a new era where patients have increased information, specifically around quality and pricing, so they can make well-informed decisions. Their goal is to drive competition. One of the questions in the FAQ document released by CMS relates to the format of the publication. Here, CMS states the format is the hospital's choice as long as the information represents the hospital's current standard charges as reflected in its charge master. CMS also made it clear in this FAQ that the requirement to post charges applies to all items and services provided by the hospital. CMS also further defined the term machine readable. Here they define the format as a digitally accessible document that can be easily imported or read into a computer system. Excel or CVS files are two examples. It specifically says that a PDF document is not acceptable. CMS also addressed the requirement for hospitals that already participate in a state online transparency initiative. It clarified that a state program does not exempt the hospital from this federal requirement. The two work concurrently. The last FAQ we are covering is the question, do the requirements restrict a hospital from posting quality information or additional pricing transparency information? Well, the answer is no. CMS encourages hospitals to undertake efforts to engage in consumer-friendly communication of their charges to help patients really understand what their potential financial liability might be for an anticipated service they obtain at the hospital, and to also ensure and enable patients to really compare charges for similar services across hospitals in their area. In other words, provide comparative charge and quality data. Next, I'm going to turn the presentation over to Brad to give a little insight on what else CMS is up to that you might not be aware of.
Thanks, Greg. And I think that last question that you referenced is really telling, and here's why. So in addition to the FAQs, we've learned some more intel which may not yet be widely known. CMS has released what they are calling a source sought notice, which really doesn't sound like much. But if you read into it, you will see that they were seeking vendors for a, quote, web-based platform to support healthcare pricing comparison and bidding activity. That, combined with the CMS administrator's comments about price shopping, leads us to believe that CMS is plotting a move towards a retail-like model that allows patients to shop for healthcare services. We could be talking about the Cars.com for healthcare. It's really not hard to connect the dots here. While the only named requirement so far is publishing standard charges online, this really appears to be the first step, or just the tip of the iceberg, in CMS's long-term intentions for pushing pricing transparency. So how are hospitals feeling about all of this? These survey results came from a recent survey of 150 healthcare provider participants on a recent webinar we did with Healthcare Business Insights. So if you're feeling concerned, you're not alone. In fact, 92% of healthcare providers surveyed are either somewhat or very concerned about how their charges will be perceived by the public. Now, one piece of this that may be getting overlooked is not only how patients will react to the charge master, but also the local media. Keep in mind, the media has never really had access to this type of data before, so I can almost guarantee that they will be all over this. The next survey finding is that almost half of healthcare providers, or 43% at the time of the survey, didn't yet know how they will address the mandate. And this statistic, which I think is a little bit concerning, is that only 29% surveyed plan to post additional pricing information beyond the charge master. So why is additional pricing information so important? And why is a pricing strategy needed? Well, here's what we know. 36% of healthcare consumers have shopped online or via a mobile app just within the last year, according to the most recent United Healthcare Consumer Sentiment Survey. And that number is only going to grow because half of the millennial generation, which is now 72 million people, is also price shopping. The second statistic, which you already know, is because CMS is demanding it. As of January 1st, 100% of hospitals have to post 100% of their charges. Now, this final statistic surprised me a little bit in that 90% of patients said that they do not feel obligated to stay with a healthcare provider if they do not deliver a satisfactory digital experience. So the bottom line, they'll just leave and go somewhere else. They don't feel obligated to stay. So the big takeaway here is this. Without a pricing strategy, consumers are going to start voting with their wallet. And if your hospital isn't providing a satisfactory digital experience with pricing information, they could end up switching healthcare providers. So this all begs the question, what do you do as a healthcare provider to meet all these new demands? We believe there are 3 different options, and we're going to explore each one. Option 1 is to simply export your CDM into a machine-readable format, such as Excel, and post it on your website. You can do this yourself and check the box, so to speak. This is mandatory. But remember from the last frequently asked question that CMS pointed out they do not restrict a hospital from posting additional quality or pricing information. In fact, the federal agency encourages hospitals to provide consumer-friendly communication regarding hospital charges, which brings us to option 2 and 3. Option 2 would be to post your full CDM, which you have to do already, and also post comparative market charges. We know that charges on their own really mean nothing to the patient. If you post this information on your website, you can start controlling the content and the ability for a consumer to view your MRI charges, for example, aligned with charges at other local hospitals, which may prevent inaccurate price comparisons. This step at least helps you to start controlling that price message. Now, the third option would be to post your full CDM and then also provide patient estimates. The patient portion versus the retail charges are often 2 very different numbers. An accurate estimate on your website that reflects the actual patient responsibility after the contractual discount and deductible will likely be much lower and provides actual value to patients. So we know that January 1st is the deadline to publish a list of standard charges in a machine-readable format. There is no getting around that. But there are things you can be doing today to start getting ahead of price transparency. First of all, you need to know how your commodity pricing compares to the market. For items that are often price shopped, will you be the high-cost provider? This is really important to know. Then, before posting your CDM, it's important to consolidate your charge master into a single file that is machine readable that also factors in pharmacy and supply items. Now, you may not have time to change your prices before January 1st, or you might think you can only change prices once per year based on payer contract language. However, the price transparency rule states that you should update this information at least annually or more often as appropriate. So this means if you lower charges after January 1st, you can still push out the updates at any time. For hospitals who do not want to submit price changes to payers, a revenue-neutral charge master adjustment is certainly an option and can help organizations focus improving commodity pricing without a revenue impact. Greg will speak to this strategy more in just a minute. Taking control of the pricing message and allowing patients to determine their out-of-pocket costs through your hospital's website may not be a realistic goal for January 1st, but it can be a goal you start working towards right away. I've outlined some ways to get ahead of pricing transparency, and now Greg is going to discuss the strategies and some other trends we see going on in the market in more detail.
Thanks, Brad. It's clear that CMS and consumers are pushing for transparency, but the question is, where do payers fit in to this move towards pricing transparency? Well, as many of you know, hospitals have not been real successful negotiating with their payers to keep reimbursement neutral and lower charges at the same time. In fact, in the past month, I've heard of 2 scenarios where payers are entering a contract negotiation, letting the hospital know that they're having trouble promoting their organization because their discounts aren't significant enough. So hospitals that may have adjusted, in other words, lowered their charges to be more price competitive, may now have a lower contractual discount, such as a 45% discount off of charges, versus their previous 50 to 60% discount from the past. While reimbursement may be the same, higher charges do give the perception that there is a deeper discount for the employer groups. There are counterintuitive components to pricing transparency, as this example shows, and there are competing objectives in the market. As healthcare providers consider lowering charges to be more price transparent, the changes can impact this discount that payers and employers have become accustomed to, especially larger discounts. It'll be interesting to see how payers deal with pricing transparency over the next year or two, but in the meantime, we need to be aware that this type of message from payers may be undermining your pricing transparency strategy. It's also further proof that while charges are the focus today, hospitals need to get a true patient estimate that reflects the true cost of service that the patient is going to have to pay, and simultaneously, organizations need to start planning really strategically on the integration of the retail price or charge methodology and their discount price or allowable strategy as it comes to modeling those 2 components. This means an integrated strategy and an integrated modeling platform for adjusting and changing and analyzing the 2 different components. Now we're going to launch our second poll question.
Thanks, Greg. And I'll go ahead and get this poll question launched. And while I do that, we are going to take a break as well for questions. So if you do have any questions, please go ahead and enter those in your GoToWebinar question pane, and we'll take them as they come. So the second poll question today is, what is your level of concern about how your standard charges will be perceived by the public? And the options here are very concerned, somewhat concerned, or not concerned. And again, that question is, what is your level of concern about how your charges will be perceived by the public? Very concerned, somewhat concerned, or not concerned. We'll give everybody about 30 seconds to vote. All right, thank you everyone for voting. And at this time, we're going to take our first Q&A break. So it does look like we have a few questions here from the audience. The first question here, and maybe Greg, you can take this, has CMS announced any further rules beyond January 1st?
Yeah, good question. Not to our knowledge, but CMS has made it very clear that they'll want more pricing transparency for patients or consumers, as we need to get accustomed to responding to. So we won't be surprised to see more mandates in the future. Hospitals should consider this to be the first step of many, which is why it's so important to get ahead of this with a pricing strategy, not just a tactical step, if you will, of posting your list of prices from your CDM.
Thanks, Greg. When CMS cites all charges, does this require professional prices?
No, not at this time. We understand the focus is on posting the technical charges, or in other words, the hospital charges. CMS at this point has not referenced professional pricing at this particular point in time.
So the next question, and we'll take one more here before we move on with the presentation. What are the most important things we should do now before January 1st?
So in our view, there are really two things you should do now. One is to make sure you have a consolidated CDM to make sure that everything from your pharmacy to supply charges are standardized and available in that document being your list of standard prices. The second is to conduct a comparative market analysis to understand how your charges compare to the local market, being those other hospitals in your close proximity to your organization. Ideally, you should publish comparative charges or retail price to at least give your patients or consumers the idea of how you compare. And I guess the third thing, just taking it one step further, you should begin thinking through and ensuring your marketing or public relation department is prepared for local media stories on the high cost of healthcare using specific examples that they pull from your posted list of prices. As Brad touched on earlier, while the list of prices are not really going to be helpful to consumers, it will likely be data that local and national media will be reviewing for future stories.
Thanks, Greg. We have one more question that we'll take here before we move on. So the term standard charges, does that include testing that is not performed at our facility?
Our response there would be if you have off-site clinics or off-site sites that operate as HOPDs, hospital outpatient departments, then those charges, those test items should be included in your CDM because if the outpatient center is a part of the facility, a part of the hospital, it should be included in that CDM file.
That sounds good. Thanks, Greg. And we will continue moving forward with the presentation. And if anybody from the audience does have any additional questions, feel free to just enter those as you think of them in the questions tab, and we'll take them in our next Q&A break.
The pricing transparency rule addresses charges, not prices, and this may drive consumers to really focus on an item that is irrelevant if taken at face value. Here are three words that are so simple but yet so confusing because they have completely different meanings for payers, providers, and now consumers. Let's break down charges versus prices. CMS is requiring hospitals to publish charges, but as we just mentioned, this really isn't helping patients know what is actually going to cost them. Most patients don't understand that retail charges are almost never paid. They also do not understand the relationship amongst hospital and payers that can't make the connection that charges are priced higher so that payers, through the negotiation process, can receive discounts. In other words, the contractual allowable rate, or in the case of individuals with no insurance, a self-pay discount. So let's look at a real example of a CAT scan of the abdomen and how a comparison of charges can play out. This example highlights conflicting material that can be found on the web or through phone calls to individual providers. When this information is posted on the web, it can be extremely confusing for patients and can be misrepresented by the hospital or the healthcare provider. Based on charges, the medical center, in this example, looks to be over 30 times the price of the imaging center. As we all know, this could be your organization. You have an opportunity to change the narrative. The patient actual price is often not that significantly different if the insurance allowable, the co-insurance, and the co-payment is taken into account. When applying the insurance information specific to the patient, the price difference in this example, the reality, is really only less than $100. The key for hospitals is to start to change this narrative to meet patients online as they're researching and shopping for services. On the timeline we reviewed in the prior slide, we discussed the importance of knowing how your prices compare. This is something you can do prior to January 1st. With consumerism on the rise, you need to know what procedures or items you're getting calls or complaints about. What items are priced shopped most frequently? Who do you compete with, being other hospitals, freestanding lab, or radiology clinics? And lastly, what procedures or services are you potentially losing volume to due to your charge rate? CMS data has been used internally by hospitals for years to compare hospital charges. Why not repurpose this data to educate your patients on charges or the retail price at your hospital versus other locations? Showing your charges compared to other local hospitals and or the statewide average charge could help better educate patients when showing your CDM charges. The price shopping could then stop at your website. Again, we want to capture patients, have them come to your website, and your site be the source of knowledge versus them continuing to shop at other locations. With CMS data, you can post heavily priced shopped items such as MRIs and eliminate the need for patients to link data from various sources or risk getting an apples to orange comparison. You can control that process. If you don't feel good about your charges, keep in mind you can change them. You don't have to wait until your next fiscal year. Many hospitals are changing their prices, their retail prices or charges, without impacting net revenue. The key is identifying and prioritizing your goals related to key factors such as market, cost, gross and net revenue, and also understand your true patient mix and reimbursement to know how to best reach each of these goals and all of the goals in totality. PMMC recently worked with Catholic Medical Center to balance their goals through a Chargemaster adjustment project. This organization knew their commodity pricing and how they looked in the market. That being said, they were well prepared for the upcoming January 1st mandate. They're actively working with their state association in New Hampshire to standardize what they're posting online. This organization is confident that they'll meet the requirement on January 1st. And they want to be clear and concise to make sure their patients, their consumers, are getting the same message. One area that they're going to work on improving is their website in order to offer a way for patients to request an estimate online by entering their insurance information. The analogy they used was that it's like putting up your house on the market, getting it cleaned up and ready to go before you actually show it to the public. For this particular client, we look at all services, including physician practices, supplies, pharmacy, in addition to hospital charges. Their outpatient clinics was included in the project, which ties into the very last question we had in the Q&A time a moment ago. At Catholic, they had three clear goals. They wanted to continue to be the low-cost, high-quality healthcare provider in New Hampshire. And when they say low cost, again, cost was synonymous with lower charges or pricing. They also wanted to stay within 95% of the market They were able to localize market data to map out a pricing strategy that allowed them to hit that target, and they wanted to stay net revenue neutral, which required them to be strategic about where to lower and raise charges. And I'll get to, in just a moment, how we got to that point of lowering charges but maintaining a net revenue neutral position. Now, the hospital also collaborated with their pharmacy department with a goal of moving away from average wholesale pricing and towards a markup formula based off of acquisition cost. We worked with them through different pricing scenarios to allow them to meet the goal of remaining net revenue neutral. Then they got internal feedback from their CFO and the budgeting department to choose the best scenario that worked for them. One of the factors to their success was comparing volume to the previous year by CPT procedure code to really see what their highest price services were. They also looked at which services were price shopped most by patients, in other words, the commodity items, and which services got the most complaints from the patient. All of this analysis allowed Catholic to determine areas where they could lower pricing in order to remain net revenue neutral. With that, we're going to launch our final poll question. Brad?
Thanks, Greg. So our final poll question is, how are you planning to address the new CMS price transparency mandate by January 1st? And the options here are to post standard charges only, post standard charges with additional pricing information, other, or don't know yet. Again, that final poll question is, how are you planning to address the new CMS price transparency mandate by January 1st? Are you going to post charges only, post standard charges with additional pricing information, other, or don't know yet? And we'll give everybody, again, about 30 seconds here to get their votes in. And then following the poll, we will pause again for additional Q&A. Okay, thank you everyone for voting. And at this time, we will take our next round of questions. So Greg, this is specific to Epic hospitals. How do Epic hospitals post all charges when Epic has pharmacy and supplies as shell records in the CDM?
Yeah, great question, Brad. So we see hospitals needing to pull out the detailed information to come up with the charge or your price for those pharmacy and supply items. CMS was very clear that they're expecting hospitals to post all CDM items. We would look for organizations to pull that information out, and you probably have to do some analysis outside of your CDM to come up with that list price of services that would and should include pharmacy and supplies.
Thanks, Greg. And then a similar question here. How do you recommend we handle pharmacy and supply charges that are based upon cost or formulary that can change often? So as CMS noted in the FAQ, you can update your prices more frequently than annually. The only requirement that they have is that you have to update your list of prices on an annual basis. Obviously, as your cost changes, you have the flexibility to update what you post onto your website, but you will be required to post all charges. For those items based on a cost, you're going to have to review and come up with a methodology that is explainable and defensible with what cost you're going to be using in terms of running that through your formulary to be able to list your price for those specific items. Thanks, Greg. And here's a question that was referencing one of the graphs we looked at. Where can you find the information that was on the CMS side-by-side comparison slide?
So that information is from CMS's standard analytic file. Many organizations previously used the MedPAR file. The standard analytic file has an advantage in that it's published on a quarterly basis by CMS and runs only 2 to 3 quarters in arrears. Your CDM coordinator should have access to this type of data. It's also something that PMMC can actually provide to you, in that we purchased this data from CMS and we can easily pull that data if you need it. Feel free to email Brad or email me if you want to have us pull a few files for you. Again, keep in mind that it is publicly available data, and you can get the charge for any hospital, and you could roll up to statewide or national averages using that MedPAR or CMS standard analytic file. The key is to present comparative data in a way that conveys the message that you want to convey.
And then another question here, you referenced Catholic Medical Center as a case study. Is there a case study document that you can share?
Yes, we can forward that material out to everyone after today's session. There was a written case study that was done, and we'd be happy to share that particular document.
So the last comment that came in from the questions, the last question answered may have meant that they had to get the test done at an unrelated provider. Can you speak to that at all, Greg? Yeah, so our take is, and CMS will likely be providing some clarification hopefully soon, that if it is an unrelated provider, that would not be something that you would have in your CDM. You may have a similar charge if it's coming out of your organization, but if it's an unrelated provider, that would likely be something that you would not be including. In other words, if you were sending out charges for a reference lab, we will do some research and also send a follow-up communication out to this group after the call as well. Thanks, Greg. So at this time, we'll keep moving forward with our presentation, and we do have one final Q&A at the end of the session if anyone from the audience does have any additional questions. So now that we've gone through how to properly adjust charges, we can now look at how to best present this pricing information to the patient online. We know that the digital expectations of consumers are changing rapidly. From another recent webinar we conducted, we learned that there's a very large gap between online consumer expectations and what healthcare providers are offering today. For example, 47% of consumers now actually expect personalized service online. However, only 7% of healthcare providers responded that they are currently offering personalized patient estimates. So this is now an expectation that we as an entire healthcare industry need to embrace. I also mentioned earlier that 36% of patients have used either the internet or mobile apps during the past year to compare the quality and cost of medical services. But maybe a more impactful statistic is this. 1 in 10 patients said that they would actually switch healthcare providers after price shopping. So to put this into perspective, let's say your hospital averages 100,000 patients a year, and if we assume that 36% price shop, that's 36,000 patients. And of those 36,000 patients, 10% said that they could switch or potentially would switch after price shopping, meaning that you could potentially lose 3,600 patients annually to price shopping consumers. So that is the real bottom line impact that we need to start taking seriously. So what do consumers want from their healthcare providers? Well, they used to just want to know, will I get better and how much will this cost? Now they want to know, how much will this cost me? Not only that, they want to know if it's a good deal. And that's why 36% are price shopping. What am I going to pay for an MRI at your hospital versus the competition in your local market? And then finally, how do I get this without a hassle? You only have about 8 seconds to capture the consumer's attention on your website. If you don't do it within that 8 seconds, the consumer will become frustrated and simply move on if they don't get the information they need, and potentially to a competing healthcare provider. So let's look at an example of how we can meet these new consumer demands, and then keep in mind the points we just talked about and how this example addresses those points. So first and foremost, we need to capture the patient's demographics. So in this example, notice that we have an option for the preferred method of contact. It's subtle, but it does put the patient in control for how they want to be contacted, and it reinforces that point about personalization I made earlier. Next up is the patient's insurance information, which is one of the key factors to providing an accurate estimate for that particular patient. So in this example, we can now select a service and even compare multiple services. Personally, my favorite aspect of this example is that I can compare prices across different facilities. So I can choose the best price based on my location. Again, it's personalized. If I'm especially price conscious, I might choose to drive a little further in order to save some money. For any health systems on the call today, this is definitely a key consideration. Now, in that estimate we just looked at, notice that we were given an exact dollar amount and not just a general price range. When we book flights or hotels, we don't want a range. We want to know the exact amount we're going to have to pay today. And the same goes for healthcare. Now, it's important to remember the data points that drive the accuracy to arrive at that exact dollar amount. When you're providing estimates to patients, it's important to remember these 4 factors: selecting the right service, selecting the right location, selecting the right insurance coverage and benefit information, and then the ability to calculate the contractual allowable amount. So keeping everything in mind that we've talked about today, how do you bring this all together with the January 1st deadline looming? And how do you guide your patients to what's not only best for them, but what's also best for your organization? This is a conceptual model of how to guide your patients and how to control the price message. So let's start with the message here. It's very simple. Know the cost of your healthcare. We mention here that CMS is requiring us to publish standard charges, but that doesn't accurately reflect what it will cost the patient out of pocket. At the top of the page, which we in marketing like to call above the fold, we try to guide the patient to the most important information with a very clear call to action in that orange button. Get your estimate now. Now, if the patient chooses not to get an estimate immediately, that's okay. If they were to scroll down the page in this model, they'll now see how your hospital compares to the local market. Now, this isn't the most relevant information for them, but it still educates them about charges and at least gives them some context. Notice, however, we're still attempting to guide them toward an estimate. So now let's get back to the CMS rule. We can still provide that list of standard charges that CMS requires, but notice how we've placed it here at the bottom of the page. We really don't want to steer patients here because it's not really the most helpful or relevant information to them. You can see here again that we are still trying to guide them to get an estimate. Now notice we've tried to guide the patient 4 different times to get that estimate, and we only linked to the list of standard charges once. As long as you link to the list of charges in a machine-readable format that CMS outlined, you will have successfully met the requirement. The bottom line is that you will have to post standard charges no matter what. Everyone on this call will be doing that on or before January 1st. We just believe there is a better way to educate your patients, and we want you as the healthcare provider to control the pricing narrative and not CMS. So now I'd like to open it up for any final questions we have from the audience. So one question we have here, and I can take this one, Greg. What's the best way for our hospital to present patient estimates on our website? So I would say that the example that we just walked through is definitely a conceptual model, and it really is up to you and your hospital how you want to present pricing information and what is most important to your patient demographics. But there are three critical factors that you need to include, and that's the ability to select the right service, to select the right location, and then the ability for the patient to select the right insurance coverage and benefit information that really drives that accurate estimate. Another question here we have, Greg. When CMS cites all charges, does that mean a rehab outpatient charge if it's a separate location?
Yes, that would be our understanding. You would need to list all charges. If you have a separate location that's a part of the hospital, like a freestanding center, you would want to list those charges as well.
Thanks, Greg. And I think that concludes all the questions we have from the audience. And I think we did have a lot of good questions today. And some of them were tactical relating to the rule. But I would like to say that I think the big takeaway here is that everybody is going to have to adhere to this mandate by January 1st. But it really goes beyond just posting that standard charge master. I think it's really important to think ahead and have a clear strategy and think about what the implications are for posting just the standard charge master, and really think about what is most meaningful and relevant for your patients.
Brad, I couldn't agree more. And I think everyone needs to be prepared over the next few weeks because it's quickly going to arrive, being January 1. Key tactical steps, and that's posting your CDM file. But the bigger picture that needs to be addressed is we need to be looking as an industry and as healthcare providers, how do we come up with a strategy that addresses the critical piece of not just charge transparency, but really pricing transparency, and make sure we're providing our patients, our consumers, what they're looking for. In that piece, what something costs to me as an individual is going to be the real relevant factor that we're going to have to focus on as we move into the new year.